Toxoplasmosis. Contents. Brief overview of the disease, which includes a number of the disease incidents locally, nationwide, or worldwide. Characteristics and classification of the protozoan parasite. Hosts or host range. Pathogenesis or modes of infection and transmission. Symptoms, prevention, control and treatment of the disease. Recommendation or conclusion.
Toxoplasmosis is a disease that results from infection with the Toxoplasma gondii parasites, one of the world's most common parasites. The prevalence of Toxoplasma infection varies among the three regions studied, namely 49% in Malaysia, 23.8% in the Philippines, and 28.3% in Thailand. In the United States, it is estimated that 11% of the population 6 years and older have been infected with the Toxoplasma. In various places throughout the world, it has been shown that 60% of the population have been infected with the Toxoplasma. Infection is often highest in areas of the world that hot, humid climates and lower altitudes because oxes survive better in these types of environments.
Characteristics and classifications. Toxoplasma gondii, a member of Apicomplexa, is the sole species. It is an intestinal coccidium that parasitizes member of the cat family as definitive host and has a wide range of intermediate hosts. Infection is common in many warm-blooded animals, including humans. In most cases, infection is asymptomatic, but devastating disease can occur. The only known definitive hosts for Toxoplasma gondii are members of family Felidae, or domestic cats and their relatives, and sporulated oocysts are shed in the cat's feces. So how does Toxoplasma gondii infect its host? Intermediate hosts, including humans, can be infected by indigestion of oocysts shed in the cat's feces. Unlike most other apicomplexan parasites, Toxoplasma can be transmitted between intermediate hosts by either vertical or horizontal transmission.
Pathogenesis. Host cells are destroyed by active multiplication of T. gondii. Necrotic foci may result. Congenital infection often involves the retina and brain. Focal choroidititis may result in impaired vision. Brain involvement in immunosuppressed patients may lead to large necrotic abscesses. Disease reactivation in immunosuppressed patients may result from rupture of a tissue cyst. Modes of infection. Infection is often asymptomatic. Immunocompetent individuals may present with fever, lymphadenopathy, muscle aches, and headaches. Congenitally infected children may suffer impaired vision and mental retardation. Immunosuppressed patients have several nervous system diseases. Transmission. Toxoplasmosis is not passed from person to person except in instances of mother-to-child transmission and blood transfusion or organ transplantation. People typically become infected by three principal routes of transmission. Foodborne, animal to human, mother to child, rare instances. Foodborne transmission. The tissue form of the parasite can be transmitted to humans by food. First is eating undercooked, contaminated meat, especially pork, lamb, and venison, or shellfish like oysters, clams, and mussels. Second is accidentally ingesting undercooked, contaminated meat or shellfish after handling it and not washing hands thoroughly. And third, eating food that was contaminated by knives, utensils, cutting boards, or other foods that had contact with raw, contaminated meat or shellfish. Fourth is drinking unpasteurized goat's milk. Animal to human transmission. Cats play an important role in the spread of toxoplasmosis. They become infected by eating infected rodents birds or other small animals. The parasite is then passed in the cat's feces in an oocyst form, which is microscopic.
People can be infected by accidental ingestion of oocyst after cleaning the cat's leather bags when the cat has shed Toxoplasma in its feces. Accidental ingestion of oocyst in a contaminated soil. Drinking water contaminated with a Toxoplasma parasite. A mother-to-child transmission. A woman who is newly infected with Toxoplasma during or just before pregnancy can pass the infection to her unborn child. Rare instances of transmission. Organ transplant recipients can be infected by receiving an organ from a Toxoplasma positive donor. Rarely, people can also be infected by receiving infected blood via transfusion. Laboratory workers who handle infected blood can also acquire infection through accidental inoculation.
Symptoms: swollen lymph glands, especially around the neck, muscle aches and pains, headache, fever, generally feeling unwell, inflammation of the lungs, inflammation of the heart muscle, inflammation of the eye, for example, the retina or at the back of the eye. Prevention: certain precautions can help prevent toxoplasmosis. First, wear gloves when you garden or handle soil. Second, don't eat raw undercooked meat. Third, wash kitchen utensils thoroughly. 4. Wash all fruits and vegetables. 5. Don't drink unpasteurized milk. 6. Cover children's sandboxes. For cat lovers, if you're pregnant or otherwise at risk of toxoplasmosis or its complication, take these tips to protect yourself. First, help your cat stay healthy. Second, avoid stray cats or kittens. Third, have someone else clean your cat's litter box. Treatment of toxoplasmosis in immunodeficient patients is often fatal if not treated. Treatment is recommended for at least 4 to 6 weeks beyond resolution of all clinical signs and symptoms, but may be required for 6 months or longer. Healthy people or non-pregnant, most healthy people recover from toxoplasmosis without treatment. Persons who are ill can be treated with a combination of drugs such as pyrimethamine and sulfadiazine plus folinic acid. Pregnant women, newborns, and infants can be treated, although the parasite is not eliminated completely. The parasites can remain within tissue cells in a less active phase. Their location makes it difficult for the medication to completely eliminate them. Persons with ocular toxoplasmosis are sometimes prescribed medicine to treat active disease by their ophthalmologist. Whether or not medication is recommended depends on the size of the eye lesion, the location and the characteristic of the lesion, acute active versus chronic not progressing. Persons with compromised immune systems need to be treated until we have improvement in their condition. For each patient, it may be necessary to continue medication for the rest of their lives or for as long as they are immunosuppressed.
In conclusion, infection by the protozoan parasite Toxoplasmosis is widely prevalent in humans and animals. Although it causes asymptomatic infection in immune-competent adults, Toxoplasmosis can cause devastating disease in congenitally infected children and those with depressed immunity. So, if you have a weakened immune system, we recommend you to ask your doctor about having your blood tested for Toxoplasma. If your test is positive, your doctor can tell you if and when you need to take the medicine to prevent the infection from reactivating. If your test is negative, it means that you need to take precaution to avoid the infection.
Thank you for watching.